presenting a case of supraorbital cell complication leading to supraorbital swelling. You can see in this picture on the right eye. You can see this supraorbital cell on CT scan is seen on the lateral extension of the ethmoid cell, and on CT scan you can exactly identify this supraorbital cell like this case. The supraorbital cell, also known as supraorbital ethmoid cell, is a pneumatized cell cavity located in the frontal bone above the orbit, and it is considered an extension of the anti-ethmoid ear cells. It is important in endoscopic sinus surgery due to its proximity to the frontal sinus, orbit, and intracranial fossa. And its involvement in various sinus-related pathology are there like mucocele and frontal sinusitis. This cell is situated between the medially it having the frontal recess, laterally having the orbit, superiorly having the anterocranial fossa, and anteriorly having the frontal sinus proper. The supraorbital cells typically drain into the frontal recess or directly into the ethmoid infundibulum. Proper identification of its drainage is crucial during sinus surgery to decrease the postoperative complication like mucocele or persistent sinusitis. You can see this picture, this supraorbital cell, and above this is the frontal sinus. You can see clearly in this endoscopic sinus case of mine. Clinical significance during sinus surgery like mucocele sinusitis and frontal sinus surgery. And it should be removed by endoscopic approach or external approach depending on the extension of this supraorbital cells. And you should avoid the damage of supraorbital nerve and orbital content during exenteration of this supraorbital cells. After complete exenteration of frontal sinus and this supraorbital cell, you can see this frontal glow. This sign is known as Friedman sign, and this is suggestive of completeness of the surgical work in the frontal sinus and supraorbital cell. And you can see this allergic component in the allergic fungal rhinosinusitis cases.